Hey guys, welcome back to Urology 101. I'm James Farrell and you found my video blog on common topics in urology. If this is your first time watching any of these, please, I have a bunch of videos on YouTube. Check them out. I hope you find something else that's helpful. If you're seeing this on my website, all the videos are there too, and I plan to start doing some blogging soon. And you can also follow me on Instagram. Everything is Urology 101. The first part of it is spelled Y-O-U-R. Now, let's get on to today's topic, and we're going to talk about voiding dysfunction and something that guys mostly don't know anything about, which is called their pelvic floor. Now, women know all kinds of stuff about this, and they usually know it in what's called Kegel exercises or Kegel muscles. If you say those words, really what we're talking about are the pelvic floor muscles, and more specifically, they are the urinary sphincter muscles, and they're often called the external urinary sphincter muscles or voluntary urinary sphincter muscles. But if somebody says Kegel exercises, what they really mean is you are contracting your pelvic floor or your urinary sphincter muscles, and then you're relaxing them. Those are what Kegel exercises are. And guys, you have a pelvic floor too. It's just a lot of guys don't recognize it because guys have prostates and they have multiple ways to keep urine in their bladder. And a prostate sort of acts like a cork in a wine bottle on that case. Whereas women don't have prostates, they have a shorter urethra, and they have to concentrate much more on their pelvic floor to make sure that they hold urine in their bladder. And most women at this point are going, yep, that's true. That's exactly how I have to hold urine in. And they just kind of get used to tonically holding it there. Whereas guys, because you have prostate, we don't tend to really pay as much attention to a pelvic floor. So for guys, most of the time when we're paying attention to our pelvic floor, it's because we're trying to hold off from ejaculating for a longer time because we relate that to orgasms a little bit more. So sometimes guys will learn how to hold contractions in their pelvic floor and do Kegel muscles themselves so that they can last longer for a sexual experience. Now, this also works for us in terms of pelvic floor function when we talk about urinary experiences, because a lot of guys don't understand how to use their pelvic floor to urinate. So what happens is we will see a ton of guys, especially in the military, who come in who are in their 20s and 30s specifically, and somebody will be concerned about a large prostate. So they usually will have seen primary care, and they often will come in having had PSA tests, having had rectal exams, having been told that they maybe have UTIs, and really what they come in complaining of is they go to the bathroom frequently, they don't feel like they empty. When they urinate, they've got what's called a staccato voiding pattern, meaning that they start and stop, start and stop. They feel like they have to push really hard to get urine out, and they don't really feel like they empty their bladder that well, and maybe they dribble some urine, maybe not, but those are all things, and people really haven't been able to figure out what the problem is. It's not one of the usual obvious ones. And so, rightfully so, a well-intentioned primary care doctor thinks that they might have a large prostate, even though within 20s and 30s, most people do not have big prostates. It happens, but it's just not that common. So really what you have to then think about is, well, functionally, how's a guy urinating? And so for you guys who have made it through these 3.5 minutes of me blabbering on, this is really where we get to this part. So let's go to the model again so I can show you what I'm talking about. So back on our favorite model that we see all the time. So again, let's orient ourselves. This is the side of a body. So this is sort of like we cut somebody down the middle and then we're looking at them from the side, all right? For anybody who wants some new vocabulary, that's called a sagittal view. So penis, testicles, bladder, rectum, and this is the prostate, okay? And then the tube coming out here, that's the urethra coming out to the end of the penis, and the urethra, again, remember, runs through the middle of the prostate. And this stuff that I've colored in here, these are all muscles. That is your pelvic floor, and notice that it is right below where the prostate is. So guys, you have two mechanisms to keep urine inside the bladder. Sort of three, but for the most part two. The bladder neck, right in this area, and where the prostate come together, form what's called an internal urinary sphincter. Your external urinary sphincter is the muscle layer right here in your pelvic floor that connects between your pubic bone and your tailbone. It also encompasses the rectum, and we're going to talk about that in a second. So the muscles that are right here, right next to your urethra, are the same muscles that are right here around the rectum. So that's where they are, and that's why you can have, essentially, let's go back to this. I didn't think about talking about this, but let's do it. That's why when somebody ejaculates and they have their seminal vesicles here, and they have sperm coming up the vas deferens wrapping around here, going in through the prostatic ducts and the fluid in the prostate, that's why when somebody is about to ejaculate, they can squeeze these muscles and hold it all in there longer until they sort of just lose the ability to keep holding it, and it shoots out the urethra. All right, so that's why that actually works. But when we talk about urinating and trying to hold it in, what can sort of happen is that guys kind of lose track of whether their pelvic muscles are relaxed when they're urinating or whether they're contracted. So if you think this is you, how is that potentially happening? Well, a lot of times guys will stand at a urinal, and peeing standing up is the thing that guys are all happy about. But when you're standing there, let's say that you're constipated and maybe you need to have a bowel movement, or maybe you need to fart. Well, you can't really hold that in and urinate well because those muscles are all connected. So the stuff that's going to help you keep from farting when you're standing at a urinal next to a bunch of other guys, or keep you from having a bowel movement when you're standing at a urinal, which is not a good place to poop, are the same muscles that help you keep urine in your bladder. It's that external urinary sphincter that if you contract and hold your rectum, it'll contract around your urethra and you won't urinate that well. So this is also the part where I'll ask guys, hey, when you're sitting on a toilet, do you urinate better? And if you sit and think, man, that's right, every time I sit down to pee and I sit on a toilet, I feel like I empty my bladder well, I don't have these voiding problems. It's probably because you probably fart, you may have a bowel movement when you're sitting on a toilet, but for the most part when you sit down, you cannot keep your pelvic floor contracted. It relaxes more. So you end up urinating better because that diameter of the urethra is open, it's not squeezed tight and shut by your external urinary sphincter. Now, the internal urinary sphincter, that one up by the prostate and bladder neck, the one up here, you can't control that. That's called involuntary. But this guy, he's voluntary. You can control that, right? So how do we do that and how do we pay attention to that? Well, typically if I think that a guy has voiding dysfunction, like it's just a functional thing where they're just kind of not coordinating their muscles correctly with urinating, meaning they don't coordinate their pelvic floor muscle, they don't relax it when they're trying to urinate. What I'll try and explain to guys is you have to make sure you find the muscle. So how do you find the muscle? Well, when you are trying to urinate, get a stream going and then tell yourself, stop urinating. Just say, I want to stop urinating in your head, and make yourself stop. The muscles you're squeezing to make yourself stop urinating are your pelvic floor muscles. Those are the muscles that you need to learn how to relax fully when you pee. So if you're squeezing them, you're contracting them, that is not relaxed. What you need to do then, because you've now localized them by squeezing them, is let it go. Completely relax, and that will open up the urethra and you'll urinate better. And then what you need to work on is trying to be relaxed before you start urinating every single time. So maybe for the first couple weeks, and I'll tell guys this, look, for the first number of times, every time you go urinate, try and squeeze those muscles and stop urinating so you find them and then completely relax them so that you can feel like you empty your bladder more. And if you have to do it sitting down for a while, then you do it that way and just get back to trying to urinate a little more normally. Because it's really frustrating. Urinating is so funny. It's one of those things nobody thinks about and nobody cares about until it's a problem. And then every 1 to 2 hours in your life, you're thinking about it and you're chronically thinking about it. It's like, what is wrong? This is driving me nuts. It's affecting my quality of life, and that's absolutely true. So if you can just sort of try and relax, then hey, if you sit down for a while to do it, that's okay. It's not, you haven't harmed your body. It's not a problem. It's just something you kind of have to work out. And frankly, I think a lot of guys in the military run into this because they're very used to always having to be early on something. They're very used to having to stand up straight, clench their butt cheeks, and don't move. And then they don't get to relax for a certain amount of time and relax those muscles when they actually go to the bathroom. So I actually think it's a pretty common problem in the military, partly because of that. Now, one thing that you can do in addition to just trying to practice it on your own is actually get a referral for something called pelvic floor physical therapy. That actually exists. It's a very well-defined concept, and they'll help a little bit more so with these ideas. So what they'll do is something called biofeedback, which is where they place little electrodes between your legs. They get right up in your business, right between your legs, in your perineum, near your anus, under the scrotum, all around that. And they will have you urinate or have you contract those muscles so that you can see it actually on a readout for where those, for the little pads that are placed. It'll tell you what muscles you're contracting, and it'll show you when you're contracting them. It'll show you when you're relaxing them, so it can help you understand how to control them better and how to relax them better. And that really does help guys urinate better over time if they've sort of gotten mixed up signals in their 20s and 30s, because it's pretty easy to get yourself in this rhythm where you don't have a lot of time. Maybe you're dealing with constipation. Maybe you just have some trouble feeling like you're really relaxed when you're trying to urinate. Stage fright's a thing. All guys have stood at a urinal and had like 14 other guys come and go in the same amount of time, and you're just sort of standing there going, okay, when am I going to pee? Right? Every guy has experienced that. And sometimes you can just start to build on that sort of annoying experience, and it gets worse and worse, and then it gets harder to just sort of control things. So there are ways to solve that. I hope that makes sense. The main thing is to just find those muscles, learn how to relax them fully, and if it's a farting, constipation thing, bowel movements, then sit down for a while and get used to it that way. And I think actually it will help out how you urinate. I hope that makes sense. Send me your questions, send me your concerns, and we will go from there. My best to you guys. Have a great evening.